Good afternoon, everyone. I'm Congresswoman Jan Schakowsky from the 9th Congressional District of Illinois. So as of noon today, the United States is facing 149 coronavirus cases, and we have unfortunately lost 10 people now to the disease, the COVID-19. So this is clearly a public health emergency. It is an emergency not only here in the United States, but the possibility of an international pandemic. And it's only going to get worse if we price the diagnostic tests, the treatments, and eventually the vaccines out of the reach for patients, the seniors, all of the healthcare workers that we're relying on, and people who just simply need to survive. So last week, I was able to question Secretary of Health and Human Services, Alex Azar, who is a former CEO of a pharmaceutical company of Eli Lilly, and asked him if he could assure us that the treatments, the vaccines, would be affordable to anyone who needed them. And this is what his answer was. I'm saying we would want to ensure that we work to make it affordable, but we can't control the price because we need the private sector to invest. The private sector is to, the priority is to get vaccines and therapies. Price control will not get us there. In other words, asking what seems to me the moral thing, the safe thing to do to make sure that all drugs and therapies are available at a reasonable price, he would not answer that. And just a couple of days after that, he wrote me a letter that unfortunately I think pretty much restated that what he wanted to do was try as hard as he could with Big Pharma to keep those prices down. That is just simply not acceptable. We have already spent, as taxpayers, $700 million, and in the bill that just got passed yesterday, there's another $300 million. That's $1 billion of taxpayer money. And the big question now, are we going to turn this over to the pharmaceutical companies who are going to decide if there's enough profit in this to make sure that all consumers can get what they need? And I say absolutely not. In the legislation that we passed yesterday, it says that, and I will just read you what it says from the text. A couple of things. It says, the Secretary may take such measures authorized under the current law to ensure that vaccines, therapies, and diagnostic development from funds provided in this act will be affordable in the commercial market. It says may. It does not say shall. He may do that. And then there's a provision that says, provided further that in carrying out the previous provisions, the Secretary shall not take actions that delay the development of such product. In other words, if the pharmaceutical companies aren't willing to comply, then we will pay what they ask us in order to make sure that they will actually develop the vaccines and the treatments. And so I think that built into our response are gifts to Big Pharma. That is not the way that we need to go.